Okay, so let us begin today's session with writing assessment criteria. So, as we discussed earlier, uh, this is based on several criteria. The first one is purpose. Okay, that criterion is assessed out of three. Whereas there are some other features, like here you can see content, conciseness and clarity, genre and style, organization and layout, and language, right? And these all criteria are assessed out of seven. Okay. Today we are going to discuss on the maximum score so that you can understand that how exactly you need to perform. All right. So let's begin. So the first criterion is purpose. There are two features. Here you can see it should be immediately apparent and sufficiently expanded into the course of the letter. Now, you know that medical professionals are always busy, right? And they want to have the information handy. So, immediately apparent, the reader should know straight away that what is the reason of writing. Okay, so it should be immediately apparent. So, let us see what does it mean. And also, I will cover sufficiently expanded means what. Okay, you want to inform the reader that, okay, this is my patient, this is the problem, and this is what I'm expecting from you. So that should be in your introduction paragraph. And if you suppose write that I'm writing to request follow-up care, what kind of follow-up care you're expecting should be elaborated into the last paragraph. Okay, now let me show you one of the model letters so that I can explain you the same thing more in detail. So here you can see in the introduction paragraph that request is quite clear. Okay, here you can see the request is for ongoing care and support following his discharge tomorrow. So this shows that I'm expecting follow-up care after discharge for this patient. Now, what kind of follow-up care I'm expecting is elaborated at the bottom. Okay, here you can see that I'm expecting monitoring of the patient's diet. Yes, I'm expecting the reader to administer paracetamol, right? And also to keep the patient warm. Now, this request has to be justified into your body paragraphs. What does it mean? Suppose if I'm saying that monitor patient's diet. Now, if you have not elaborated in your body paragraph that why dietary modification or monitoring is necessary, then reader will get confused. Right? So here you can see that monitor patient's diet. Why? Because patient has lost the weight. Right? We have already referred the patient to the dietitian and appropriate nutritional intake has been arranged. So that is why dietary monitoring is required. Okay, if you request that administer paracetamol, it should be very clear that why I'm requesting this. Okay, patient still has, here you can see some dry cough and chest pain. Okay, so that justifies my request of administering paracetamol. Okay, I'm requesting that please keep the patient warm. So here I should have the history that patient got fever and rigor. Okay, so this is how your purpose is elaborated or explained throughout the letter. And if you are successfully able to do this, you will score 3 out of 3. Okay, and if you are lacking elaboration, then your score might get reduced. Okay, so it depends on what you have skipped. Okay, I hope it is clear. Now we will move towards the next criterion. So this purpose is scored out of 3. Okay, the other criteria are scored out of 7. So what you should do here, the next is content. Okay, so okay, let me see, it has stopped working. Next criterion is content. So content says that all the key features should be included in your letter and it should be accurately represented. Now, what does it mean? What is the meaning of content? If I say that this is a glass of water, what is the content? Right? It should be a water or milk or whatever it is, right? So, what is the content of your letter? It is what your letter is filled with. That means body paragraphs, right? So when you select the information, make sure that you do not skip anything. Okay, you should not skip any information that may hinder the patient's care. Okay, so try to include all the relevant information. Now sometimes you may feel that I get confused, like if I'm writing to the endocrinologist, okay, or if I'm writing, suppose, to any other, like endocrinologist still work with the things, but suppose you are writing to the oncologist, okay, and the patient has diabetes. Now you may feel that oncologist is not going to treat the diabetes, why should I write? Or the other things, that diabetes is a condition that relates with almost all body system. What if oncologist is going to perform surgery? Yes. So if you get confused whether to write or not, and if you are in dilemma, you should always write the information rather than skipping it. But make sure that you do not give long elaboration on that. Okay. Only key features, all the relevant details should be extracted from your letter and it should be fully elaborated. Now, second point of content says accuracy. What does it mean? Now, accuracy, sometimes we get slip of tongue, right? Similarly, we may also get slip of pen, right? Sometimes we see that patient's age is 46 years old, and we write 49 years old, right? This happens. Or sometimes writing the dates is faulty. So these all kinds of mistakes will reduce your score in accuracy. All right. And it also, sometimes it also happens that when you convert the information from the case note to the like case notes are notes, right? It is into the note form. But when you convert it into full sentences, sometimes you just change the meaning. Okay, that should not happen, right? Suppose here the third point says that good nutrition, fluids, eggs, fruits, vegetables needs health monitoring diet. Now, suppose you haven't read the bracket information and you have just written that patient's nutrition includes so and so. Okay, but you have not requested monitoring. Then you will lose the score in accuracy. Correct? So you need to keep in mind that your information should be accurately explained into your letter. Okay, fine. Next is conciseness and clarity. Now here we have four features. The first is length. Now length of your letter, like word count, starts from your introduction paragraph till the end of your last paragraph. Okay, and it should be ideally 180 to 200 words. But I strongly suggest you not to focus too much on word count. If you are writing little more or little less, it is okay. But make sure that you have not included any irrelevant information and you have not excluded any relevant information. Okay, if you have written everything which is needed for the reader to know, and then if your word count is more or less, it is not going to affect your score. Okay, second is omission of irrelevant details. See how nice it is. You are not only getting score for writing the important information, but you are also getting the score for the information which you are not writing in your letter. Okay, so that means you know that what is the scope of practice of the reader, right? So based on the expertise of the reader, based on the experience of the reader, and the kind of care the reader is going to provide, you are going to select the information. Okay, now here I have written, means I have taken a small portion of the case note, and this is from the official website. Okay, so here you can see that in March 2024, the child, this is a letter for of child, okay, not child, I can say it is 18 years old. So now we can start considering this client as an adult. Okay, so 18-year-old patient is this, okay, having the problem of alopecia, that is hair loss and associated depression. You are going to write this letter to the nurse practitioner for the ongoing monitoring of the patient, because here you are a school nurse and the patient will be transferred into the university. So you are writing to the university nurse practitioner, okay, to monitor this patient's health. So here you can see that in March 2024, patient came to the school clinic. Okay, here you can see presented with hair loss in patches and anxiety. Yes, possibly onset started after school incident. I request you to please keep your, yeah, thank you. Possible onset was school bullying incident. Patient said not a major thing. Referral to trichologist specialist. May 2024, trichologist like assessed, might have assessed, no etiology established, possibly exacerbated by stress. Prescribed steroid cream, okay, like betamethasone, dipropionate 0.05% cream 1 to 2 times a day for 3 months. Patient got personality changes, aggression plus sleep loss, and medication discontinued. Now, I would like to ask you that which information is important? Do you think that we should write every damn thing? No. We may write that in March 2014, patient presented to school clinic with hair loss in patches and anxiety. Here we suspect that it is after school bullying incident, but patient said that not a major thing. So I think we can exclude this information. But important is that we referred the patient to the trichologist specialist, right? So I have selected this first point and the last point from the March 2014. Now, when patient came in May 2014, trichologist examined the patient with no etiology, okay, steroid cream prescription. I think this is important that trichologist has assessed the patient, but no etiology established, possibly exacerbated by stress. I don't think so that this is the relevant information. Why? Because at the end, we haven't found any positive changes. So for the practical nurse, or sorry, for the nurse practitioner, it is important to know that the patient was referred to the trichologist who prescribed the steroid cream. However, due to personality changes, aggression, and sleeplessness, the medication was discontinued. Right? So I'm omitting that no etiology established, possibly exacerbated by stress. I'm omitting the name of the medication. Instead, I'm just informing that it was a steroid cream. Okay, what was the outcome? Why medication was discontinued? This much information is enough. Okay, and it creates a good summary, right? So when the clarity will be disturbed, when you are including lot of irrelevant information, think that I'm writing every damn thing which is given. Okay, then my reader will get confused. Then, okay, what should I do the next? Right? Or he or she may get confused that okay, whether the like etiology has been established, whether it was found with the stress, whether it was after the school bullying incident. Okay, what happened exactly? Okay, so don't make your reader confused. Okay, right? Which is important, and concise it. Okay, make it short. Okay, so here you can see you can just finish this task by two statements. Like in March 2014, Mr. X presented with the complaints of hair loss in patches and anxiety. Okay, he was referred to the trichologist who prescribed steroid cream. However, due to personality changes, aggression, and sleeplessness, he discontinued the medication. Does it make sense? I am giving a clear information with a good summary, with excluding irrelevant information that will help me to maintain the length of my letter. Good? Yes? No? Yes? Okay. Fine. The next is genre and style. Now, this criterion says that your language should be technical and polite. Well, you're writing as a medical professional, so you cannot write informally, right? Your language has to be formal and in a request manner, right? So here I have written some of the examples. Instead of saying that, let me know if there is anything I can do to help. Instead, you can write, please feel free to contact me for any assistance. Yes? Which one is good? First or second? Second, right? Fine. Let's see
Second
the
one.
next. Yeah, that's right. Okay. What is the next? Can you change her dressing? Suppose you are a registered nurse and writing to the home care nurse. Still, can you use this language in your like when you are giving in a written form?
No,
No.
ma'am.
No, right. Okay. So here we can not ask in informal way that can you please change her dressing? We may say that I would appreciate it if you could change her dressing. Yes. So this shows that you are using appropriate gender. Send this patient to physiotherapy clinic. No. Please refer Mrs. Smith to physiotherapy clinic. Okay. So make sure that the language you use is appropriate to write as a medical professional and appropriate for the reader as well. Okay. And always use non-judgmental approach. Okay. I know that we live in a country where making judgment is quite easy. Okay. But start thinking as a Western countries. Okay. As a people of Western countries, they're extremely non-judgmental. So instead of writing that the patient is heavy smoker, patient is alcoholic, patient is obese, okay, this is your judgment. Instead, give them evidence. Okay, patient's BMI is 30. Okay, you may write that patient smokes suppose 20 cigarettes a day. He consumes 5 units of alcohol on weekends. Okay, so that will give appropriate data and without any judgments. Fine. Don't use contractions. Okay, not I am. You should write I am. I am writing to refer, not I am. Okay, so like I didn't administer the medication. No, not didn't. It's did not. Okay, hasn't, has not, wasn't, was not. Okay, so don't use any kind of contractions. That is also informal. Okay, and we don't use it in formal letters. Now, coming to the last point, abbreviations. Now, whether we should use abbreviations or not, what do you think? Should we use abbreviations
We
in the
can use
letter?
according to scope of the
Yes, we can use if the reader is medical professional and if the abbreviations
Yes,
are
ma'am.
universally common, right? Here in India, we
Hmm.
write SOS for if necessary. Okay. In developed countries, it is used as PRN for when necessary. Okay. So the reader may get confused. So we use universally accepted abbreviations. So I will suggest you to write full form as long as you are aware of the full form. But do not use full forms if it is complicated. Like if you're writing CT scan in a full form, if you're writing MRI, using full forms. The reader, it is very time consuming and sometimes complicated for the reader to interpret, okay, when we are in hurry. So it is better to use CT scan, MRI, USG, okay, that we use, even layman can understand, okay, but do not use BD, TDS, PRN. It is better to elaborate, okay, twice daily, thrice daily in that form. All right. I hope I have made this clear up to now. Now, the
Yes, ma'am.
last is not last, second last is organization and layout. Now, this is sometimes very challenging. Okay, students collect appropriate information and need to write everything properly. But because in the case notes, the information is scattered, okay, it is difficult to jot down. So I will always suggest that think about the sequence of events. Okay, how the incidences happen. Suppose patient fell down first, then he might have brought to the emergency department. Then you might have done assessment. Then you might have referred the patient for the investigations. Then you might have started the treatment. Then you might have just seen the patient's progress. Okay, so think about how the events happen. What is the order of the event? And you can write accordingly with the dates or the time references. But if you think that no, this is the later where priority matters. Okay, here suppose patient has hypoglycemia due to drug interactions. Okay, patient has suppose double dose, patient has taken double dose of metformin. Okay, and now patient is hypoglycemic and referring the patient, you have already sent the patient into the ambulance and you are writing to the recipient. In that case, of course, you need to write about the current situation first, right? So you need to understand that there are two ways of organizing your information. The first one is chronological way, that means how the incidences happen. And second is thematical way, that means based on the patient's priority. Okay, so you need to prioritize the information. So these two factors come under organization, and the layout is later format. Okay, that you need to learn. And if you don't know, you can watch the previous video on OET writing method lesson. Okay, and the last criterion is grammar, about which majority of the students are concerned. Ma'am, my grammar is not appropriate. I don't know tenses. I don't know passive voice. I don't know relative clause. It is okay. Okay. This is only one criterion out of these many things. So, of course, you needed to sharpen your weak areas, but understand that this is not the end of the story. Okay. There are a lot of other things that you can work on till you improve your grammar. Okay, so let's see what all things are going to be assessed. That is connectors. Okay, what kind of connectors you should use, you should avoid, or whether connectors are important after each and every statement. Yes or no, that you can learn from upcoming videos. Okay, then passive form. If you know active form, then only you will be able to convert it into the passive form, right? So you should learn the tenses, of course, and you should practice it every day if your level of English is not up to the mark. Then relative clause, punctuation, vocabulary, all certain things are going to be assessed in grammar. Okay, so yeah, that's it. So let us revise. Okay, writing assessment criteria starts with your purpose, and that will be out of 3 band score. Okay, then you have content, okay, in which we have seen two things. Okay, that patient content means including all the relevant information, excluding all the irrelevant information, and whatever information you are giving should be accurate. Yes. Second is conciseness and clarity. Your length of the letter should be 180 to 200 words, but it is not the mandatory word length. You can write little less or more. You should exclude all the irrelevant information which is not necessary for the reader to know to provide further care. Summarize your information effectively, which gives clarity. Next is genre and style. Your language has to be polite and formal. Don't use any judgmental approach. No contractions and use appropriate abbreviations. Okay, organize your letter, be flexible in organizing. It will always depend on the type of case note you have been provided. So be flexible, select one of the ways of writing, either chronological or thematical, and write according to the letter format expected by the OET. Okay, and you should, of course, have the right grammar that will not change the meaning. Okay. I hope you have understood everything about writing assessment criteria, and I'm pretty sure that it will definitely help you to enhance your score. Yes?
Yes,
Yeah.
ma'am.
Okay. Do you have any question about